There are many schools of therapy, probably 100 or more schools of psychotherapy, but I would say they come under two categories, maybe three. One would be called the psychoanalytic Sigmund Freud, sometimes referred to as psychoanalytic or psychodynamic. And that school of thought, which I have been trained in and I subscribe to, is a theory that teaches us that the human mind operates both on a conscious level and an unconscious level. So the contribution that Freud and psychodynamic thinkers have made is helping us understand the unconscious mind. That's one contribution. The other contribution that psychoanalytic or psychodynamic therapies have taught us is that childhood affects the adult personality, so that we have to look not only at where we're at now, but where we've been throughout our lives. So the emphasis on the unconscious, the emphasis on development, taking a look at dreams is something that psychodynamic therapists have taught us. Sigmund Freud taught us that the dream is the royal road to the unconscious. When people present dreams, I like to explore them in light of what's going on with that patient. Also, defense mechanisms. Psychoanalytic theory has taught us that we all use defense mechanisms, which are healthy and necessary, and they prevent us from being overwhelmed by anxiety. And then the final thing that psychodynamic or psychoanalytic therapy teaches us is that there typically is transference and countertransference that take place between the therapist and the patient. Transference is the unconscious, sometimes conscious feelings that the patient places on the therapist. So, for example, in my work with patients, sometimes I become their father, sometimes I become their mother, sometimes I become their sibling, sometimes I become early childhood figures, friends, etc. And countertransference is what the patient stirs up in me, that sometimes when I'm with a patient, they can remind me of people in my lives. So that's the contribution that psychoanalysis makes. I would not say that I practice psychoanalysis, but I've had significant training in psychodynamic therapy or psychoanalytic therapy. And I can talk for hours about that as we go on. But in addition, I'm a firm believer in a school of thought called cognitive behavioral therapy. And I believe that it's important to integrate the two. Cognitive behavioral therapy teaches us that we're not upset by events in our life, but rather by our thoughts about those events. And thoughts are called cognitions. And there's a whole school of thought that I subscribe to that says if we're feeling depressed and anxious, not only do we have to look at childhood issues and unconscious issues, but we also have to look at how our thinking facilitates some of these moods. And I've been very influenced by two or three people in the field of cognitive behavioral therapy. One is Dr. Albert Ellis, who I actually trained with in New York City. He was the founder of a school of thought called rational emotive therapy. And then there was Aaron Beck, a psychiatrist out of the University of Pennsylvania, who really did amazing research in the area of cognitive therapy. And one of his students was one of my mentors over a period of 30 years, Dr. Arthur Freeman. And Dr. Freeman was trained both in psychoanalytic theory and cognitive behavioral therapy. And my own style has integrated those two, thanks to some wonderful mentors, especially Arthur Freeman.